When looking for medical care in northern Michigan, patients would always prefer to be close to home. That's why Munson Healthcare is trying to bring more specialists to more hospitals. In today's MedWatch report, Michelle Dunaway shows us how that's reducing travel times and improving care.
It's like childbirth or worse. It's like a knife in your back. It's a constant. And there's times where I have gotten sick, literally, throwing up.
That pain stemmed from huge kidney stones, something Janet Rouse has dealt with before.
Got the x-ray. My kidney stones, the one on the right side was 15 centimeters, and it did damage to my tube that went to my bladder. And so she had to put in a stent. And then my first surgery, to take the first one out on the right side, was January the 18th, and the second was February the 28th, and the one on the left side was 17 centimeters.
Those surgeries were a success thanks to urologist Lynn McCormick, a new addition to Munson Healthcare Cadillac Hospital.
That's part of the initiative that the hospital and the Munson system had in bringing me here, and that is to be able to cover the need. The hospital has been unfortunately having to make sure that patients are cared for, but the need here was larger than the ability to take care of the patients, and so patients had to go out to differing areas.
Finding care close to home was a big deal for Janet.
I have limited income, so, gas-wise, and it makes it more convenient and just easier for me to go in to see her and, go in for checkups.
And aside from being convenient, Janet is more than happy with the care she received.
I felt at ease. She is very, personable and explained things well, and I just had a lot of faith anyway, and just knowing that things would be okay.
Dr. McCormick says that care goes beyond the surgery, so making sure patients have easy access to their specialists is crucial.
It's very good because it helps give me the one-on-one ability to reach to patients and to get to know their families and to get to know their support systems and to help them maintain their disease, especially patients with cancers and patients with large stone disease like Janet has, because patients like that are going to have long-term care, and that's very important because we're going to need to continue their follow-up so the patients don't get lost in the shuffle. And in today's healthcare environment where there is a shortage of caregivers, it's very important to have that follow-up and to know that she'll be able to contact me through my staff, and that I'll be able to follow up with her and my other patients, and they won't get lost in the shuffle.
For MedWatch, I'm Michelle Dunaway.